Welcome to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti. My guest this evening is Dr. David Banach from UConn Health. Dr. Banach, welcome. How are you?
I'm doing well. Thanks for having me on again.
Hey, thanks for coming down. It's been a while. What's new?
You know, working through COVID, taking it one step at a time, one day at a time. But yeah, we're working through it.
There you go. So tell us a little bit about your background and how long you've been with UConn Health and exactly what you do.
Sure. So I'm an infectious disease doctor. I take care of patients with different infections, both in the hospital and in the office. And my other role, I am the healthcare epidemiologist for UConn Health. And in that role, I focus on our infection prevention related activities now, which has been almost primarily dominated by COVID, but pertaining to other kinds of infections in the hospital and focusing on prevention. And then I'm also involved with our medical school and our postgraduate educational programs at UConn Health as well. So a little bit of all those things.
Very busy. Very busy person, absolutely. So let's see, what do we want to talk about? We want to talk about COVID first, or we want to talk about infectious diseases? Your pick.
We can start with COVID. That seems to be on the forefront of everyone's mind.
You got it. So where should we start about COVID as far as where we are now compared to where we were last time you and I talked?
Well, I think, gosh, we spoke several months ago, maybe almost a year ago. So I think, in a lot of ways, we're in a better position. We've got new challenges, but we've got more tools to fight COVID. So, I think, most recently, going back to January, we've seen this Omicron variant circulate. Here in Connecticut and now throughout the world, and it seems to be highly contagious. A lot of folks becoming infected, and fortunately, in terms of the consequences of the infection, we're not seeing the rate of hospitalizations that we had seen during previous surges. And I'm trying to remember the last time we spoke, but I think it was during those earlier surges where we saw a lot more hospitalizations. And that has its own concerns. But here in Connecticut, we are seeing a lot of infection. That's for sure. Our community transmission is still quite high. So important to be mindful of that. And we've got a lot of other things in our toolkit too, and we can talk about those as well in terms of prevention and treatment.
Well, let's talk about prevention and treatment of COVID. Where do you want to start?
Sure. So I think the vaccinations have really been the primary means of prevention. Early on, before vaccines, we really focused in on a lot of the what we call non-pharmaceutical interventions. So, physical distancing, masking, were really kind of all we had. And there was always, originally a big focus on hand washing, which is always important, and environmental cleaning, those kinds of things. But I think once the vaccines came out, that was certainly a real game changer, at least in terms of preventing the severe consequences of COVID, really hospitalizations, mortalities. So that's been a real game changer. With the vaccines, we've seen tremendous benefit. Here in Connecticut, we're fortunate that a very large proportion of our population has been vaccinated, and I think that's why we even during previous surges where other states saw higher rates of hospitalizations, we haven't seen that as much here in Connecticut. So the vaccines are doing their job. I think as one might expect, there's limitations to the vaccines. They're not going to be 100% in terms of preventing all infections, including mild infections, but they're still holding up quite well, particularly for folks that got a booster dose. To get that added layer of protection. So, I think that's really tremendous. And, we've got some other new preventive measures too, relatively new. So we've got now monoclonal antibodies that we use for prophylaxis in our immunocompromised patients who can't respond to the vaccine. And that's been really important. So, thinking about groups like people that are on immunosuppressing medications, and may not get that immune response to a vaccine, but have an alternative that can sort of supplement the vaccines to provide protection against infection. So in terms of prevention, I think we're making good progress. And I think there's going to be even more to come in terms of the next generation of vaccinations coming down the pike.
What do you think the next generation of vaccinations coming down the pike are going to look like?
I think there's a few different ways that we're going to see new vaccines. I think we're going to see vaccines that have been adapted to Omicron, so variant-specific vaccines. The vaccines that are currently being used now are still the same ones that are based on the original strain of the virus, we termed it kind of the Wuhan strain, and that spike protein. But, as the virus changes, we need to be able to adapt our vaccines accordingly. So I think we're going to see some new vaccines that have sort of broader immune responses associated with them that may confer a higher level of protection. One area that I'm actually particularly excited about are intranasal vaccines. There's been a lot of attention on these recently. In fact, a couple of big news articles that came out in the last week on the progress that's being made for intranasal vaccines. And I think that can be really impactful in terms of reducing milder infections. So, with the current vaccines, we see they do protect against, really severe infection. They protect well against pneumonia and that process of infection, but people still are subject to getting the upper respiratory symptoms. But a nasal vaccine may be able to block that even better. Prevent the virus from even attaching in the first place to the nasal mucosa, and that can be beneficial both in terms of preventing the milder infections, but also maybe even preventing transmission even more. So I think that's something that's definitely generating a lot of excitement in the scientific community.
Absolutely, and obviously, if you get the nasal version or the shot version, obviously it'll basically do the same thing as far as protection goes, correct?
Yeah, I mean, I think, they'd probably be intended to use in concert with one another. So, the injectable vaccines would be able to prevent you from like that systemic infection, pneumonia, but the nasal vaccines would offer that added protection in the nose. I think, that they can be kind of complementary to one another. And I'm hopeful they'll become available relatively soon, but we'll have to see.
Absolutely. Now, can we maybe talk about the different variances of the virus and exactly what that means? Because you see on the news the different variances, but they don't explain exactly what each variant is and maybe a little bit more in detail.
Sure. So, this virus and, all coronaviruses, they do mutate. Coronaviruses tend to mutate more than a lot of other viruses that are out there. So the changes that we see are not, too surprising. So, you may recall the original, Wuhan variant and Alpha variant. Those were that's what we termed like the early variants. There were some subsequent mutations that occurred that led to the next sort of generation of variants. So you may recall the Beta and moving into Delta. Delta was a big one in the summertime, fall. That led to a big surge of cases, particularly in certain parts of the country. And then most recently in December, January here in the US, we saw this Omicron variant. And the thing that was different about Omicron was that it had so many mutations that really that spike protein, which is the one that is important because that's what the immune system kind of responds to, was very mutated and allowed for two things to happen. It allowed for the vaccine to become more infectious. Right. So it spread quicker than the previous variants, but it also was able to evade some of the immunity from both prior infection and prior vaccines. So that's what we saw with Omicron variant. And interestingly, over the last few months, we've been seeing smaller changes to the Omicron variant. We term these subvariants. So you'll hear things like BA1, BA2, et cetera. These are subvariants, so smaller changes, but changes that can still have impact in terms of some evasion from the immune system, from the vaccine-induced immunity to some degree, and then that can result in infections. Fortunately, in all the cases we've seen so far, all the variants we've seen so far, there is still that protection against severe infection from vaccine that's still holding up. But it does allow for some escape from the immunity and to cause generally milder infections. So that's what we're seeing now, these different variants of Omicron. And I think we have to be mindful of whether we see more of these like subvariants that look very similar to Omicron, or if we see a significant change that would be much different and more impactful. I think the other fortunate thing is with the Omicron variant, generally the cases overall seem to be milder, and that may be related to the nature of the variant, just causing milder infection, less likely to cause lung infection, more likely to cause upper airway infection, and therefore milder disease. But we have to pay close attention to these, and we've got very robust surveillance systems that can track new variants as they occur, whereas going back like a year or two ago, we were really just in the early stages of even learning what it means to be a variant. So I think we've made a lot of progress, both in our understanding of them, but also being able to detect them more readily.
Absolutely. Now, as far as the virus goes, for where we first began to where we are now, how does that stand?
Yeah, I mean, I think, a lot of the mutations that we're seeing are more about making the virus easier to transmit, so more contagious. Fortunately, they aren't necessarily making the virus more severe, so the infection's more severe, and that's been fortunate. But we'll have to see. We'll have to see what changes occur. These coronaviruses, like I mentioned, they do mutate relatively readily, and that doesn't necessarily mean that every mutation is going to lead to another spike of cases or more severe infection, but definitely something that we'll have to keep an eye on.
Absolutely, absolutely. And as far as, let's talk about masks, and obviously the different types of masks out there as far as protection-wise goes.
Yeah, so masking's been interesting. If you may recall, like in the early phase of the pandemic, where there was such a short supply of masks, a lot of homemade masks and cloth masks. Now, fortunately, in terms of masks, we have much better supply, even for like the higher quality masks. So we have, surgical masks, and now for like an added layer of protection, there's you may have heard the term KN95. Yep. And then at the highest levels, the N95 respirator. Those are the kinds of respirators that we use in the hospital when we're taking care of like severely ill patients with COVID. But even the KN95s do offer good protection. They're thicker, they have a higher level of filtration, and they also fit closer to the face. So those are both advantageous. So, my general approach is, at this point, masks are not, we don't have mask mandates or requirements, right. But in some situations, there's benefit to wearing a mask, particularly for people that feel that they're more at risk, more vulnerable. And now that we have a ready supply of high quality masks, like the KN95s, those can really be beneficial in situations that people may feel put them at higher risk. So, if you definitely, look out there, try to find, a high quality mask. I really am sort of in the phase where I would like discourage the homemade, the cotton masks, the cloth masks. I think there's less of a role for that, and now more of a role for these higher quality masks when people feel like they're needed.
And like you said, they're a lot more readily. The KN95s are a lot more readily available now than they used to be when everything first started breaking out.
Yeah, I think that's been a plus. The mask industry has really increased production, and that's also not only increased the supply but brought the cost down a little bit. The initial KN95s were their short supplies are very expensive, and now they're readily available, less expensive, and accessible to people that desire to wear them.
Yeah, absolutely, absolutely. And obviously, if you don't know, if you're going out somewhere and you don't know where other members of the public have been, put a mask on.
Yeah, I think during periods of high transmission, like we're in right now, if you're going to be in an indoor environment, particularly one where you're going to be in close contact with a lot of people and you're concerned about your risk, those higher quality masks can offer a little bit more benefit in terms of reducing the risk for becoming infected.
Absolutely. Now, is there a difference between all the different types of vaccine, or do they basically do the same thing?
Well, there's a lot of different vaccines that are out there. Here in the United States, the primary vaccines that we've been using are the Pfizer and Moderna vaccine. They're very, very much more similar than different. They both use the same kind of technology. They use this mRNA technology that helps to generate the response to that spike protein to generate those protective immune cells to protect against infection. The Johnson & Johnson vaccine, which there's been kind of a shift away from that. Because of some concerns about adverse effects in certain populations and maybe lower efficacy compared to the mRNA vaccine. So that uses a slightly different technology to be able to generate those protective immune cells. But throughout the world, there's a lot of other vaccines out there too. And here in the U.S., they haven't been FDA approved yet. But there's different techniques out there, some of which have been more effective than others. Some of the vaccines that are used in other countries are more based on sort of the traditional vaccines that we use for like the flu, using kind of inactivated virus as opposed to mRNA. Those may have a role here in the U.S. too at some point in the future. Like I said, there's been a wide range of effectiveness. Some of the vaccines have been very effective in other countries, some of them less so. I think there's a possibility that in the future, I think we'll still continue to have these mRNA vaccines, but we may have an expanded armamentarium of vaccines available, which include vaccines that use other types of mechanisms to generate immune responses.
Now, as far as safety precautions at the hospital, what can people expect when they come see you as a patient?
Yeah, so in the hospital, we still maintain universal masking, and that's true, at UConn Health, but all the hospitals, and certainly here in Connecticut, have universal masking. So, when you come into the hospital, the expectation is that all of our healthcare providers, our patients, our staff, our students are all wearing masks, and that's universal with patient care. In some situations, you may encounter healthcare providers wearing additional protection like face shields and respirators, and those are indicated in certain situations. But at this point, in healthcare, we're still universally masking. There's a lot of people asking, how long are we going to be doing this for? Is this going to be indefinite? I don't think we really know, but I do think at least in the relatively near term, that's going to continue. And quite frankly, there's probably a lot of benefit even outside of just COVID. Thinking about infection risks that can occur in healthcare settings. And other respiratory viruses that, probably in a healthcare environment, the masks do provide good protection against those spreading.
Absolutely, and obviously the mask will also basically add an extra layer of protection to you in case something happens.
Yeah, no, absolutely. I think, they do offer a high level of protection. Remember, in healthcare, we need to make people, even our immunocompromised patients, feel like they're able to readily access healthcare and feel comfortable with accessing healthcare. And that's, we sort of have to be thinking about our most compromised patients when we're trying to set the standard for healthcare, which is maybe, a little bit different than what, the retail store, down the street would be thinking about. They'd be thinking about more kind of your average person, but we need to be thinking about our most vulnerable, our most immunocompromised individuals and what we can do to protect them in healthcare, to keep them safe and also give them comfort with coming to see their clinicians.
Absolutely, and I'm sure people were a little bit scared about going to the doctor's office for a regular physical or.
Oh, yeah, definitely. I mean, we saw a lot of healthcare that was delayed, unfortunately, like routine care for routine healthcare screenings, and unfortunately, even taking care of like chronic medical conditions. People were too nervous to come to the hospital and kept delaying care, and that's going to have downstream consequences, and people are going to suffer because of that. So, I think it's really important that we establish that the healthcare environment is a safe place that you can come and that we want you to come to be able to receive the care that you need.
Absolutely, absolutely. So what else we want to tell people about the variants in the virus?
I think, it's the other piece that we didn't really get to touch upon is treatment options. So now, I think since we last spoke, we have much better treatment options for patients. Originally, we had the monoclonal antibodies. Those were developed pretty quickly, and they were used. They're available to patients. Unfortunately, with these mutations, with these different variants, a lot of them became less effective. But now we have oral treatments. So Paxlovid is the main oral antiviral medication that we use now. And it's been shown to be very effective in preventing hospitalizations, and now it's increasingly available. So, my advice to anyone, if you do test positive, particularly if you have any other high-risk medical conditions, or if you're an older age, certainly reach out to your clinician and ask if you're a candidate to get Paxlovid, because now Paxlovid, originally it was just in such short supply. We only stocked it in hospitals for like our most vulnerable patients, but now it's readily available, and there's many pharmacies here in Connecticut that carry it in like retail pharmacies. So it's available, and for individuals who are eligible for it, it's a good option.
And just like taking an aspirin.
Maybe not quite
Is it a
that
pill?
simple.
Is it a pill?
So it's a 5-day course. It's a 5-day course of treatment.
Oh,
The
okay.
thing to be mindful of with Paxlovid is there's a lot of medication interactions to watch out for. So it interacts with a lot of other medications that people commonly take. So that's something to be mindful of if that does come up. Definitely make sure that you, whoever's prescribing it or discussing prescribing it, knows all the other medications that you take to see if there's any interactions to worry about. Because often those interactions can be addressed maybe by holding the other medication or changing the dose or some adjustment. But important to be mindful of that because those medication interactions with Paxlovid can be quite significant.
Oh, really?
Yeah, definitely something you got to keep an eye on. Fortunately now, the pharmacists are very attuned to this, and they, will keep a close eye on things. But definitely make sure if that's ever coming on the radar and you're on other medications, that someone does a detailed interaction check to make sure there's not going to run any problems with that.
Absolutely, absolutely. So as far as the pandemic goes, I was talking to my mom last night and telling her about the show today. She was like, I want you to ask the doctor when he thinks it's going to be over, because her and a friend of hers were talking, and she was like, I don't think it's going to last that long. The virus isn't going to last that long. That was at the beginning of the pandemic, and we're still here.
Yeah. I mean, I think, if COVID taught us anything, it's that just be careful with any predictions that you make, because the virus can definitely has thrown us for plenty of surprises. Right. I think, people ask, when is it going to be over? I think, we need to think about, what does over really mean? So, does over mean that the virus is completely eradicated from Earth, right, or does over mean that we're not in like an emergency situation where we're having a lot of people get really sick and getting hospitalized and dying from COVID? There's a full spectrum by what it means to be kind of over. I think fortunately right now, we don't find ourselves in like an emergency situation like we did, certainly in 2020 and different parts of 2021 where we were seeing, hospitalization surge and people getting really sick and dying. We're not at that phase right now, and that's good. I don't think we're going to get to a point where we're going to completely eradicate this virus from Earth. It just doesn't seem likely. There's too many opportunities for the virus to find reservoirs, and now we have animals that can harbor the virus, so that makes it even more challenging. But I think the virus is now so widespread that I think it's unreasonable to expect it to be completely gone. It may turn into something that is a little bit more predictable, maybe more seasonal, like other respiratory viruses that, once things kind of settle in, we'll see ups and downs, kind of like what we see with flu and other kinds of viruses. But we'll see. I think we don't really know where this is going to land in terms of what the long term is going to look like, and we've seen all these twists and turns along the way, and making it really difficult to predict much with a lot of certainty. But we'll see. I think we should be optimistic about the increasing tools that we have to protect against the virus and to fight the virus. But we have to still be attentive to what the virus does and how it changes.
Absolutely. Now, I didn't know animals could carry the virus.
Yeah, there's a lot of species of animals that that can carry the virus. Things from like wild cats and deer and a lot. I think last I heard there were about like 20 species of animals other than humans that can carry the virus and transmit it to others. So, and again, I don't think there's a lot of human to animal transmission, between species. But knowing that there's animal reservoirs, I think does make it more likely that it's going to be a virus that's going to, stick around. Even if we have, all of the tools that we can to prevent, humans from spreading it, knowing that there's animal reservoirs, I think is going to be an added challenge. So we'll see. But that is something that I think changed some of the thinking, once we learned that there were animal reservoirs for the virus in terms of the ability to eradicate it completely.
Absolutely. Now, as far as when we watch the news at night, when the governor speaks, they talk about the positivity rate in the state of Connecticut. How is that figured out? Can we maybe talk about that?
So the positivity rate, that is the percentage of tests that are positive. There's a few, and so there's important limitations to that. So that is the percentage of PCR tests that are positive. So remember, there's a few different types of tests out there. There's our rapid home tests that now originally were really hard to come by, now are very readily available. And those, don't get reported. So the data that we get is really just based on PCR tests, and those are tests that are done in hospitals, in drive-through testing sites. Some clinics have them, some retail pharmacies have them, and all those facilities are required to report that data to the state. And that's what we're tracking with the positivity rate, the percentage of those that are positive. But it doesn't capture all the home testing that's being done, which, right now seems to be a lot. Not those tests are readily available. So, it's a helpful metric. It's not the only metric, to keep an eye on. And we just got to realize that it's got some limitations as we're tracking. I think more helpful to follow like on a week to week basis to see kind of what the trend is. But it's got limitations.
What are some of the other trends we have to follow up on just to make sure?
Yeah, hospitalizations are important. That helps us know if the hospitals are starting to admit a lot of patients with COVID, and that's helpful both in understanding the severity of infections, but also hospital capacity. And that was a really big issue back in 2020. There's also wastewater testing, and I may have heard of this, where we can monitor virus levels in the wastewater. And Connecticut actually does this much better than other states even, and being able to detect kind of if there's a rise in wastewater virus, that's a rough indication that in the community or in the state we're seeing more virus spreading. So that's another way, that we can monitor virus activity. So those are two examples of things outside of that positivity rate, which has really been a big focus to this point, but now is being recognized that it has some limitations because of the type of testing that's being done now.
I didn't realize that there was a wastewater test that they could take from.
Yep. Yeah, so Connecticut has sites throughout the state where they sample wastewater in different counties, different communities, and they can actually track how much virus is present. And the different states do this a little differently. Here in Connecticut, we've got a few sites. Actually, the New Haven area has the best surveillance. They've got a very robust program that is in conjunction with Yale, where they can really track detailed information about the amount of virus that's in the wastewater, but even the types of variants. So we can get some detailed information from the wastewater, and that's a good way to track things over time.
Absolutely, and it sounds like it's a very worthwhile program. It
is. I hope that it continues to be supported. There's some concern that if funding for these programs starts to decrease, that we won't have that option. So I'm hopeful that those programs will continue to be supported because I think they're pretty valuable.
Dr. Banach, would you mind sticking around for another segment?
Sure.
All right, we'll be right back.
Roofing scams become more common this time of year. Better Business Bureau Scam Tracker is receiving reports of shady, free roof inspections. Homeowners should be on the lookout for these cons. The person may claim that their company is working on a neighbor's home and is offering inspections to those living nearby. If they don't find enough wear and tear to merit a whole new roof, they may fabricate it by tearing off shingles to mimic wind damage, or they may simply show you pictures of someone else's damaged roof. Beware of unsolicited offers, especially after a storm. Get your insurance company to inspect your roof to verify the need for repairs or replacements. Ask for references and check out their work yourself. There are 1,200 BBB accredited roofers in Connecticut. Find the right one by going to bbb.org to look at a company's business rating. There you can check for a pattern of complaints and read reviews, and also share your experiences by writing a review yourself to help others in their search.
Welcome back to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti, sitting here with Dr. David Banach from UConn Health. Dr. Banach, welcome back.
Thanks to be back.
Thanks for sticking around. So, Dr. Banach, we talked about the virus in the first segment. I was thinking we can open this segment talking about. I actually saw you on the news the other day, and we were talking about ticks and other viruses. Yeah, so there's been a lot of attention, as there typically is around this time of year, on tick-borne infections here in Connecticut.
We have a very high tick population in Connecticut, particularly certain regions of Connecticut.
Right.
Every year we see folks get tick infections, and there's a few different types of infections that can be associated with these ticks. Lyme disease is the one that everyone talks about. It's certainly the most common, gets the most attention. But there's some other ones as well that can be pretty severe, and some people can cause hospitalizations. And the one that's gotten the most recent attention is this Powassan virus. So this is a virus that can be spread by ticks. The other organisms like Lyme disease and organisms like Babesia and Anaplasma, those are more like bacteria and parasites. But some viruses, particularly this Powassan virus, has now come on the radar as another tick infection. Fortunately, that one is much less common than the other three more common infections, but it can be quite severe. And there was a first case of Powassan virus this year reported a few weeks back that got a lot of attention.
Now, as far as prevention of ticks, what can you do to prevent?
Yeah. I mean, tick prevention is really critical here in Connecticut. So, a few of the key take-homes. Before you go out, know where you're going. If you're going to be going into a wooded area, particularly in the summer and fall, where we see tick infections occur most frequently. Things to be thinking about. Trying to cover up your skin as much as you can. So, long pants and long sleeves if you're going to be out in the woods and the brush. The tick repellent also really important. So there's a lot of really effective tick repellents out there. The CDC actually has like a really detailed website that describes all the different sort of approved tick repellents. So spraying down with tick repellent is an important measure. And then other things to be thinking about when you come out of the woods, come back home, going inside, taking off your clothes, laundering them on a high heat, and then taking a shower and doing a tick check. All can be really important. If you do identify a tick, taking it off quickly can help reduce the chance that tick's going to lead to an infection. So definitely measures that people should be thinking about in the summer and fall months where we see these kinds of infections occur here in Connecticut.
Absolutely, and obviously, if you want more information on what tick repellents to use, go to the website and we can.
CDC, like I said, has a great website with there's a full list of the different products that are available, things to look for, and it gives you guidance on tick prevention. So I think that's a great place to start, think about the strategies that you're going to be using, particularly if you're going to be outdoors in a wooded environment where these ticks tend to reside.
Exactly, especially now because the weather's getting warmer and people are outside a lot more. And
absolutely. We're seeing a lot of tick infections. There were, I think over the last couple of years, we've seen an increase, here in Connecticut of some of these infections. Important to have them on the radar. And then, certainly, as clinicians, when we see people coming in the summer months here in Connecticut, and they have symptoms that might be related to a tick infection, we got to be thinking about that when we're doing our assessments, and that'll help guide decisions about testing and treatment for those patients.
Now, what are some of the symptoms for tick infections?
So they can vary. So for Lyme disease, the classic is that bullseye rash that is very sort of telltale for Lyme disease. For some of these other infections like Anaplasma, Babesia, sometimes people will come in with flu-like symptoms, so fevers, achiness, joint pains. Sometimes excessive fatigue, sort of like you're getting the flu, but we generally don't see flu in the summer months. So if someone came in with like flu-like symptoms in the summer or in the fall when we don't really see flu spread, tick infections would be on the radar, particularly things like Babesia and Anaplasma. That would be things to be thinking about. So if you're not feeling well, particularly if you are worried that you had some exposure, you were outdoors recently, certainly, a tick-borne infection needs to be on the radar when trying to think about what might be going on.
Absolutely. And as far as you mentioned flu, how important do you think it is to go get your flu shot?
Yeah, flu has been really interesting this year. So, typically when we think about the flu season, we think mostly in, the late fall, winter months. But for reasons that I think we still don't quite understand, but certainly, related to COVID and things surrounding COVID, we're seeing flu occur later. So even, as recently as the last couple of weeks, we've been seeing flu activity at a pretty high level here in Connecticut. So, the vaccines are still effective. They're still out there. I think in the last couple of years, there's been so much attention on COVID vaccines that people are maybe not thinking about flu vaccines. And the vaccine uptake in the last couple of years for flu vaccines has been lower than what we'd seen in previous years. So, and I think it's still important to be thinking about. We typically stopped offering flu vaccines around April, May, but this year we've extended that because we're still seeing flu activity. So, still a way to protect yourself against the flu. And they're still pretty readily available.
Absolutely, yeah. And sounds to me like they're pretty effective as well.
Yeah, it's variable year to year. This year is a little difficult to get a full assessment because, like I said, we didn't see a lot of flu activity in the winter months. So a little difficult to know exactly how well that flu vaccine matched the circulating flu strains. But I think there still is benefit, and the common strains of flu that we're seeing are included in the vaccine. So I think there's definitely some impetus to go ahead and get that flu vaccine if you haven't gotten one yet. But what the flu season is going to look like in the future, is now becoming a question mark. Are we going to see differences in terms of the seasonality of the flu that's been impacted by COVID? Maybe, but I think I don't quite have an answer to that yet.
Now, can you get the flu vaccine and your COVID shot in the same day or no? Flu vaccine in one arm?
So that's important. So originally when the COVID vaccines came out, they recommended like a time interval between getting the COVID vaccine and other vaccines. But now there's been more data that shows that that's not necessary. And you can get both of them on the same day. I think the general recommendation is to get them in different arms, but the timing interval that's needed, like a gap, isn't there. And I think one other thing that's interesting about vaccines is now there's a couple of vaccines in trials that are actually combined flu and COVID vaccines.
Really?
I know some of the companies are working on that. So maybe that'll be something that we'll be looking at in the future, where you can get a vaccine that's protective against both.
Like a combination shot.
Exactly.
That would be a good thing.
We'll see. I think there's some optimism about that.
No, absolutely. So what else we want to talk about? Infectious diseases and.
Yeah, gosh. I mean, I think flu and tick-borne infections and COVID are really the predominant things that are on everyone's mind. Okay. I think we still are seeing the infections that we used to see in the hospital, and fortunately made a lot of progress in preventing a lot of those infections. We're a lot better at preventing hospital-acquired infections now than we were a couple decades ago. So, and that's a big part of what I work on as well. The strategies that we have in the hospital to prevent those kinds of infections. But I think we're making good progress in that area, and we just got to be mindful. We hear about these rare infections. You may have heard of it. There was an outbreak of bird flu here in Connecticut. Fortunately, it didn't affect humans, but it only affected a few areas of poultry farms. But something that we always got to keep a lens out for, and we're always to some degree concerned about new viruses emerging, and particularly viruses that could possibly spread between animals and humans. So something we always have to keep an eye out for, and if something does come up, we got to really be thinking about it.
Absolutely. Now let's talk about the bird flu. What is it, and what causes it?
Yeah, so it's a type of influenza. So just like the human flu strains, there are strains that circulate among other species, including birds. And they can be they can spread very easily between birds. Okay. This is something that's seen pretty common year to year in poultry farms throughout the world. Fortunately, we don't see them very often here in the United States. But when they do occur, they can be quite significant in terms of affecting bird farms and poultry farms. And then, like I said, what we really need to look for is if there's any potential for spread from animals to humans. And I think that we hear about these sporadic cases of that happening on an individual basis, like a poultry farmer becoming infected. Fortunately, that seems to be quite rare so far, but something we always have to be mindful of if we do see that, and then worry that a bird flu strain could potentially spread. But like I said, to date, we haven't been seeing that. But we got to be on the lookout for these new viruses and see if anything is going to raise the concern. on a broader public health level.
Now, what happens if you are a human and you come in contact with some form of poultry or some sort of animal that contracted
well, I
the
think
bird
the
flu?
first step, common things being common, the things we worry about with poultry are more bacterial infections like salmonella. That is far more common. So if you're going to be handling poultry, thinking about bacterial infections like salmonella should probably be the main focus. And the best way to protect yourself from that is twofold: by washing your hands after touching poultry. You can, with good hand washing, you can eliminate the salmonella bacteria from the hands. And then when it comes to like cooking foods, the poultry, making sure that your poultry is well cooked to kill any salmonella bacteria. So that's really the most important thing to be thinking about when we're talking about poultry. These other viruses, again, very rare, but more from like a surveillance and public health level, we have to be on the lookout for these. But I think the main message for someone handling poultry or working on a poultry farm, we're seeing a lot of folks have poultry farms at their homes, usually on smaller scales. Just making sure that if you're going to be out with the poultry, that you really wash your hands well before you go in and touch food or touch other people.
Exactly.
Hand washing is really the most critical piece.
Absolutely. And how about we circle back and talk about the virus?
Okay.
And
The avian poultry influenza, you're saying?
Sure.
Oh yeah, I mean, that very rare. There have been only a handful of cases occurring sporadically throughout the world, so I wouldn't necessarily focus on that.
Okay.
There's other viruses on that. We talked about COVID spreading between animals and humans, and that's something that we always have to be on the lookout for. If we ever see that someone who had unusual animal contact develops a viral infection that we can't explain, then thinking about those more exotic kinds of viruses are on the radar. But for the general public, the risk of that is quite low. So not necessarily something that you would need to be particularly mindful of. Really, and I can't stress the hand washing enough. We see people come in with really nasty salmonella infections who work on poultry farms. I think these are largely preventable with good hand hygiene.
Right, absolutely. Now, as far as besides hand washing, how useful is hand sanitizer, and is there
Very useful. Hand sanitizer for almost all kinds of viruses and bacteria infections is just as effective as soap and water hand hygiene. So, I think if you're going to be in a situation where you're coming in contact with a surface that a lot of people are touching, you're concerned that there might be some, bacteria on there or viruses or anything like that. Good, hand washing with soap, with hand sanitizer can be effective. Something to be mindful of. We see other kinds of viral intestinal infections. So norovirus is a big one. We hear about outbreaks of that in cruise ships, in healthcare facilities, in daycares. We see diarrhea-related outbreaks. For all of those, really hand washing is quite effective. I think if you're going to be in an environment where those kinds of infections can occur, really being attentive to good hand washing and using hand sanitizer when it's available can be effective. Some of these infections, hand washing with soap and water can be a little bit more effective for some of these viruses. But for most infections, the hand sanitizer can be quite effective, and I encourage people to use it if they're concerned.
Absolutely, and obviously all those hand sanitizers work the same way. And especially especially out there, and now they have the Clorox wipes. Those probably work too to kill bacteria. Yeah,
they're good. They're a good disinfection. I think the key thing is if you're going to be touching a surface that a lot of other people touch. That's what we want to be thinking about: hand hygiene and disinfecting. So for most surfaces, that's not an issue. But there's a lot. If you think about it in our day-to-day lives, we touch a lot of things that a lot of other people touch, and a little bit of hand sanitizer, washing off your hands afterwards can actually be quite a benefit.
Absolutely, and hand sanitizer is now readily available. I remember during the start of everything.
Yeah, it was in shortage.
You couldn't find it.
The disinfectant wipes, the hand sanitizer, all cleaning products. I remember the stores were out of them.
I know.
quite remarkable. But yeah, fortunately now the manufacturing is really ramped up accordingly, and all those products should be very readily available.
Absolutely, absolutely. And as far as the coronavirus goes, as far as when we first started back in the first stages of it to where we are now, how are we looking?
Well, I think we've made a lot of progress. It's still around, and I think there's some fatigue associated with that. People are frustrated. A lot of people, a couple of years ago, were thinking that this was just going to be a temporary thing. We were going to get through it after a few weeks, a few months, and gosh, we're like, now years later and still talking about it. But I think in terms of perspective, I think really important that people keep that lens on that. In terms of how people are doing when they become infected, we're not seeing hospitalizations and mortality anywhere near where we saw before. We're seeing a lot of people become infected. These variants are very contagious, very infectious. But the overwhelming population, particularly those who have been vaccinated, really have milder symptoms, and that's really important. We have more tools. We have vaccines that are now readily available. We've got more vaccines coming that are going to be sort of the next generation and better vaccines, and I think there's a lot of reason for optimism for that. And we've got more treatments coming too. Now we have some very effective treatments for people in the hospital, and now we have oral antivirals that have good data behind them. So I think we've made a lot of progress over the last couple of years. There's definitely fatigue out there, and I understand that. We're all feeling that, but I think we have a lot to reflect on in a good light, and a lot that's going to help us in the future, building upon these new technologies, new medications, new vaccinations that are going to help us not just for COVID, but for all infections in the future. So I think there's reason for optimism, and even despite all the fatigue that everyone's having, I would encourage that optimism moving forward.
Absolutely. Now, as far as the other options of we talked earlier in the segment about the oral version of the medication to prevent the virus. Can we maybe talk about that?
Yeah, so we've got these oral medications. Paxlovid is the main one that we use for treatment. It's an antiviral. It helps stop the virus from reproducing. And it has been shown to be effective in preventing more severe infections and hospitalization. So, I think it's really important, we talked about it a little bit earlier, but I really want to emphasize that, if you do develop COVID and test positive, reaching out to your clinician to see if your Paxlovid's appropriate. I think, there's some awareness in the community, but I think there's a lot of people that aren't aware of this treatment option and that it's readily available. Certainly way different than we were, many months ago when we just had monoclonals and they were in very short supply and only for like very small percentage of the population. But now these oral antivirals are much more readily available. So have that discussion, with your clinician to see if they're appropriate for you if you do develop a COVID infection.
Absolutely. Now, as far as how important do you think the testing sites are as compared to the home tests?
Yeah, I'm glad we're talking about that. So, testing, so there's a couple of different tests that are out there. We've got our rapid tests, which are antigen tests. They're very effective. They perform very well with the Omicron variant that we're seeing now. A few things to think about. They are dependent on getting a good sample. So really important that you actually follow all the instructions, get a good sample. Right. And they're limited too. They're not as sensitive at picking up virus as the PCR tests, which are now the main ones that are being offered at healthcare facilities. So those tests are a little bit more sensitive. The antigen tests are less sensitive but quicker. So if you get a positive antigen test, that you're done. I think that means that you don't need to do additional testing. That's a positive test, and you proceed accordingly in terms of isolating and getting treatment. If you have a negative one and you're having symptoms that might be from COVID, I would encourage people to not stop there and either get a follow-up PCR test or do a second antigen test. Usually like 12, 24 hours later. And if you get two negative ones, that provides a little bit more reassurance that it's not COVID. Because like I said, the sensitivity of those tests is not as high as the PCR tests. So just bear that in mind when you're doing home tests.
Now, obviously, it's probably a lot easier to go get the PCR test rather than taking the home test, because if you do it wrong, you got to do it over again.
Yeah. I mean, the PCR tests, I mean, those are usually done by like a medical professional. So the sampling is more reliable with those, and the test itself is more sensitive. And now they're pretty readily available. You may remember we had like these wide, huge testing sites, kind of moving away from that with like these big drive-through testing sites. Although most healthcare facilities now have a drive-through testing site and have PCR testing available. I remember in December, January, there were like huge lines, and it was really, really difficult to get a test. Fortunately, we don't have that shortage right now with getting tested. So, those are readily available, through drive-through testing sites throughout the state. And, if people are concerned, that's a good option.
Now, do you guys have testing sites up at your facility?
We do, yeah. At UConn, we have a drive-through testing site that operates, for many hours during the day, including weekends. And if you're looking to get a drive-through testing site, test at UConn, for instance, you can go online, set it up through, we have an ordering process that there's the website kind of walks you through. We also have a phone number where you can call and schedule a test. And that's pretty much true for all the major like healthcare institutions throughout the state. If you want to get a test there, you can jump on their website and follow the instructions to set that up. And like I said, they're pretty readily available now. We don't see like the long lines that we had seen back in December, January, where there was such a short supply. So, I would, if you're concerned that you're having symptoms or you had a high-risk exposure, those are available to get tested.
And usually, if you get tested, the results come back in 24 to 48 hours?
Yeah, no, we've seen shorter turnaround times. So, a year or two ago, that's what we were looking at. Turnaround time for the drive-through test was long, 24 to 48 hours, and that is unfortunately, less helpful. The longer you wait, the less helpful it is in terms of getting early treatment and maintaining like isolation from other people. So I think most facilities now have shortened that quite a bit. I don't like to give an exact turnaround time because it varies from day to day and time to time at facilities, but generally less than 24 hours. Seems to be the norm, and some even like less than 12 hours for turnaround time. So that's good.
I know. I actually had surgery. I had cataract surgery back in December, and I had to go for a COVID test. And we went on a Friday afternoon. My results were in to me at like 3 a.m. the next morning.
Oh, okay, good. Yeah, I mean, I think. That kind of turnaround time is good. I mean, you may remember like back, in the early phase, it would take days to come back, and some places are turning around testing in like a week, and at that point, it's just not very helpful. But we're seeing shorter turnaround times. Not quite at the level of like a home test point of care, but still pretty good.
Yeah,
so I think we've made a lot of progress, and a lot of that is improvements in our just processes with being able to process the tests and kind of streamline the whole process, which I think is really good, not just for COVID, but even for like other types of testing. Now we have better processes in place to turn around testing quicker.
Now, once they do the test to process it, do they send it out to a lab or do they do it?
It depends. A lot of them do send it to their lab at their facilities. So, for instance, at our drive-through site at UConn, you would get the swab taken and they would send it up to our microbiology lab up at the main hospital where we run all of our tests. And other hospitals do it a little differently. They may have like a central lab for like all of their different sites to send specimens to. Generally, those types of PCR tests are run out of like a big hospital lab, and even like the private labs like Quest, run them as well.
Yeah, I'm sure with everybody doing them, they probably did test results 24 hours a day.
Yeah, they've got huge testing operations, and they've made a lot of progress too with getting quicker turnaround times. I remember Quest, and other private labs at the earlier phase just took a lot longer to get test results, but they've really improved that quite a bit.
Absolutely. Well, Dr. David Banach from UConn Health, we're about to run out of time, so hopefully we'll have you on again soon.
That'd be great. Thanks again for having me on.
Thanks a lot. On behalf of David Banach, I'm Pete Mezzetti. Thanks. Good night. We'll see you next time.